This is Dr. Peter Madsen. It's my pleasure to be presenting on behalf of Drs. Jesse Taylor and Gregory Hoyer from the Children's Hospital of Philadelphia on our chapter entitled Craniopagus Twins. First, we'll be discussing some of the demographics and classification schemes of Craniopagus twins. We'll discuss the considerations that need to be taken when planning separation surgery. We'll discuss some of the surgical techniques and principles that have been established over the past few decades. And then we'll also go through some of the more recent innovative strategies of twin separation. Craniopagus twins are exceedingly rare, with a reported rate of anywhere from 0.6 to 2.5 per 1 million live births. There seems to be a female predominance to the disorder. The most general basic way that Craniopagus twins can be classified is either as partial fusions or total fusions. Partial fusion Craniopagus twins share a very limited surface area and have no involvement of the deeper structures, so nothing deeper than the skull. But in total Craniopagus twin fusion, there's a significant shared surface areas, and they have involvement beyond the skull into the dura, vasculature, or parenchymal levels. And it's important to note that even despite modern techniques and advances in critical care and care for these patients in the postoperative period, there is still quite a high mortality rate with Craniopagus twin separation, and still approaches 50% in some cases. Craniopagus twins can be further classified based on the orientation of the two heads. There's angular type, which, as the name would suggest, have an angular orientation between the two heads, and vertical type, which are oriented in a straight vertical way. Vertical twins are further subclassified into type 1, 2, and 3 based on the degree of orientation between the faces. Work has also been done to better define the preoperative risk that patients have going into a separation surgery. The main determination of these risk stratification schemes have to do with the degree of connection at the various anatomical layers. One of the major determinants of preoperative risk has to do with the amount of shared venous structures between the twins, especially the superior sagittal sinus. As you might expect, complications related to separation surgery often have to do with attempted separation at the level of the superior sagittal sinus, as the injury to this structure can lead to catastrophic hemorrhage, causing significant morbidity and mortality. Authors have also determined other factors that can predispose to having a better outcome, a more favorable surgical outcome, and those have to do with the vertical orientation of the twins, a separation that is done on the earlier side, so before 12 months, and those separations that take on multi-stage approaches. Craniopagus twins should be assessed thoroughly in the preoperative setting with multiple imaging modalities. First, a CT scan, typically 3D CT scan, is obtained to better delineate the extent of bony fusion. And this is also a good tool to use in the preoperative planning to create 3D printed models for hands-on surgical planning of the surgery, of the separation surgery. MRI is, of course, important to look at the extent of dural connections and fusion, as well as the parenchymal fusions. And then, as we've mentioned, the vascular connections are critical here. So obtaining vascular imaging such as CTAs and or MRVs, as well as the digital subtracting angiography are really critical for planning these surgeries. And using the results of these vascular imaging, you can often incorporate them into the 3D models to, again, assist in three-dimensional planning of the surgery. Incision planning is also a critical aspect in preparation for the separation procedure, and should be undertaken at the very outset of any surgeries that are being performed on the twins. This plan is critical to ensure appropriate coverage at the final stages of separation to try to prevent any infections and CSF leaks. Tissue expansion is an often used technique to allow for increased surface area of the scalp that is available at the time of coverage. Multi-stage approaches have also been utilized by various groups as a means of staging the procedure and have been shown to improve outcomes. One such approach has to do with sequential ligation of shared veins between the twins to allow for a slow remodeling and collateralization between the twins over time. Other innovations that have been used, we've already mentioned 3D printing, the importance of that for a hands-on preoperative 3D modeling and planning for both the incision planning, but also the actual separation itself. Our group has incorporated techniques from the plastic surgery field. In particular, we've used distraction osteogenesis techniques where we separate and then apply distraction device, which slowly over time are able to remodel the orientation of the twins to a more favorable orientation and create more separation between the twins to allow a little bit easier corridor to perform the surgery in. And other groups have also recently investigated neurointerventional techniques. Instead of doing multi-stage venous ligations in an open technique, these groups have performed this in an endovascular fashion, where they sequentially sacrifice veins from the inside to allow for slow remodeling of the venous connections. So we just wanted to highlight a case from our group to show some of these considerations in action. So this is a case of Craniopagus twins, two female patients identified. As you can see here, this is their fetal MRI at 20 weeks gestation, identified in utero. They were born at 30 weeks, so premature due to concerns about cord entanglement. At birth, they weighed about 2 pounds, 1 ounce each. And from this picture here, you can see that these could be classified as angular type total fusion Craniopagus twins. On their preoperative imaging, we see significant bony fusion of the twins. On MRI, there was no parenchymal fusion, but there was shared dura. And importantly, on the vascular studies, here's their MRV showing a shared superior sagittal sinus importantly involving the posterior 2/3 of the sinus, but no torcular involvement. So there's a couple features of this case that make it high risk. The angular type fusion is often more challenging for separation and have worse outcomes. And then the shared level of shared superior sagittal sinus present. When approaching this case, we look towards our plastic surgery colleagues for any techniques that could be used to potentially improve the outcome for these twins, and thought of changing their orientation from an angular to a vertical type as a means of helping with the surgery, and as has been shown by others, potentially improving their outcome. We thought this might be useful endeavor, and to do this, we employed the idea of distraction osteogenesis, whereby we did a strip craniectomy around the shared bony fusion between the twins, and then applied a distractor device to slowly separate and remodel the orientation of the twins over time. They also hope to change the vascular configuration between the twins with this slow distraction to try to encourage collateralization to decrease the amount of shared venous sinus structures between the two twins. So this is the distraction technique in practice. You can see the twins with the custom-made 3D printed distractor device in place. The twins were distracted by 2 millimeters per day for a total of 20 millimeters. Our ability to distract was eventually limited by some formation of pressor ulcers at the site of contact of the distractors. And you can see on the right side what we were able to achieve. The twins went from an angular type configuration to a completely vertical orientation on the bottom there. We then performed a constriction process where this band was placed around the connection site between the twins and slowly inflated over time. As the inflation occurred, the surface area between the twins was shrunk down, eventually leading to a smaller surface area that needed to be separated at the time of surgery. We then also did tissue expansion to increase the surface area of skin available for coverage at the time of separation surgery. Here you can see the incisions that were planned prior to taking out the tissue expanders. And then intraoperatively, here's a photo of the shared venous connection, highlighting a large cortical vein that was crossing from one side to the other. So the lessons here from our experience and from the literature, Craniopagus twins are a very rare entity, but despite advances in surgical techniques and in management of these patients, the morbidity and mortality of separation surgery remains still high. And there are certain features that can be used to help predict a successful separation and factors about the patients that could potentially be optimized in preparation for surgery. But at the end of the day, this is a very complicated and complex problem that requires a very highly skilled, multidisciplinary, collaborative effort to provide the best possible outcome for these patients. And we're hopeful that innovations can be further realized that will help to improve outcomes for separation surgeries. Thank you very much.